Hi, my name is Rachel, and let me break down a topic on blood clots today. Blood clots are also known as thrombus, and it is a semi-solid mass of blood that forms when liquid blood changes into a gel-like state. Normally, clotting is a protective mechanism, and when you get a cut, platelets and proteins in the plasma stick together to form a plug that stops the bleeding. However, clots can also form in deep veins without any injury. This is inappropriate and it's called thrombosis, which now restricts or blocks blood flow. So not all clots are dangerous. However, if they form inappropriately, they can be life-threatening. Let's talk about the complications associated with blood clots. The first one is called DVT, deep vein thrombosis. This is now when these clots form inside the deep veins, and it's most common in legs, and it comes with a lot of pain, swelling, redness, and warmth. That is a sign and a symptom of DVT. The other one is called pulmonary embolism. This is now when these clots break loose and they travel to the lungs, blocking the blood flow. We have stroke, or rather ischemic stroke, formation of clots in the brain arteries. We have myocardial infarction, heart attack. This is now when there is clot formation in the coronary arteries. What about the risk factors? This is what will lead to this inappropriate clot formation. The first one is prolonged immobility. If you are at bed rest, bedridden, you are at high risk of getting these inappropriate clots. Trauma, surgery, obesity, smoking, pregnancy is also a risk, and we have something called genetic clotting disorders. Yes, it can be heredited. When we come to the diagnostic test, we have a number of tests starting from the dimer test. We have Doppler ultrasounds. We have CT pulmonary angiography. This is the gold standard test for testing for PE, or pulmonary embolism. We have venography. We have MRI venography. For venography, this is now use of contrast dyes, but it's rare but very accurate for DVT. We also have coagulation studies. Things like prothrombin time, that's PTT, and INR. Those are some of the tests we do to test for these clots. Let's talk about management or treatment. In management, you can use medications or surgical procedures. For medications, we use anticoagulants, things like heparin. We have thrombolytics. These are used in severe cases of stroke and PE, pulmonary embolism. When we come to surgical procedures, we have thrombectomy. This is now the physical removal of this clot. We have the use of catheter. When we use catheter, we administer the clot buster drugs directly to where the clot is. We also have IVs, things like IVC filters. All those are the ways of managing these clots. And lastly, let me talk about precautions. What can you do or not do? The first one, be active, exercise, also keep hydrated. Be active and keep hydrated, especially during long trips. Managing these risk factors, quit smoking, control your weight, all this. We also have controlling or managing underlying conditions, because this clot can extend to formation, leading to things like liver diseases, kidney disease, all this. That's how bad a clot, an inappropriate clot, can cause damage. So in conclusion, clots can save your life during injury, and also clots can be life-threatening if they form inappropriately. So recognizing signs and symptoms early and seeking medical care or attention is key to preventing these complications. That's all for blood clots, and stay informed, stay healthy. And thank you for watching the Health Lab.